yourself as the MA or the nurse or physician, whomever is going in there, you have to be able to communicate well and tell that parent that is there with them or the caregiver that they need to hold on to the patient. Giving a child an immunization can be extremely tough, not only for the parent, obviously for the child, but also for a medical assistant.
In the past, whenever we had to visit the doctor, my daughter would be frightened at first, and then she'd kind of calm down. But then when it came to the actual shot, she would get scared again.
Well, I think when children are afraid, it just increases the anxiety in the room for the providers, for the medical assistants, for the parents. You know, the children's anxiety really feeds off of everybody else's feelings in the room.
One of our concerns as medical assistants is, can I trust this parent to do exactly what I've asked them to do? Are they going to hold the arms tight enough so that there's not an accident that can happen? We recognize that the parent is one of our best allies, one of the best things for the child to have in the room. So being able to coach that parent properly so that we feel that we can trust them is a big part of a successful visit. The POKE program was created with a team effort. MAs, child development, child life specialists, nurses, physicians, and even parents. And we worked together, we learned from each other, heard each other's perspectives on what worked or what didn't work or experienced it. Since we know that comfort holds can be safe and can provide the child with a much better experience, we want to provide the training for our staff so that they can carry that experience over in their practices. The POKE program provides an evidence-based framework for the development of a child-centered, individualized POKE and procedure plan. And the plan is to give the child a voice and a choice, and also to collaborate with families so that we can provide the best possible experience for everyone.
When we were choosing the comfort holds, we decided to try to make it a little more fun for the children.
And they provide different kinds of holds for the different kinds of anxiety levels that might be happening with a child. So the first one we have is Totally Turtle, and that is where the parent actually can get up behind the child on the exam table, and the child can sit between their legs, so the child's back is to the parent's chest. The parent can wrap their arms lovingly but firmly around their child, hold their arms in place so that the MA or the nurse giving the injection will have access to their legs, but little limbs cannot be flying all around. The next one we have is called the Funky Monkey, and that's where the child is still on the table, sitting up. The parent is standing to the side, and they can wrap their arms around them, kind of like a monkey holding a banana tree. Again, their arms are restrained tightly, but it's not an aggressive hold. Parent is right there with the child. The third one is if the child is very worked up and patient safety is a concern, we can have the child slightly laying back. So they'll be laying kind of at an angle, but the parent will be scooping them up on the table. Their face will be close to their face. We call that butterfly kisses. And essentially the face of the parent is so close they could give butterfly kisses on the cheek. They can whisper in their ear. They can sing a song into their ear, but the child is still close and is not laying flat, being restrained.
I have to say that when the comfort holds were first rolled out to us before we had any training, there was definitely a lot of apprehension amongst myself and the other MAs, which is kind of like, okay, how is this going to work? Because the parents have to have an active role just like we do. So it's kind of our biggest hesitation is, okay, we can get on board if we can get the parents on board, and then everybody can feel safe. But after going through the training and seeing some of the comfort holds displayed, seeing some video interaction with parents that have done it, and then experiencing myself and trying it with different patients, it's really more doable than it looks like on paper.
The updated information is really helpful time to time basis, so that's really makes us more comfortable and giving us more information that provide us more answers or to the parents and more other different better ways to deal with the patient.
My daughter now, when we go to the doctor, she is nervous every time we get there. But then as soon as we're there, we start showing her all of the things, and we talk about how mommy and daddy are going to be with you and will hold you, and she actually seems to have a fun time. It's helped a lot. And I think just that security that she feels now and that comfort of knowing like what's going to happen has helped a lot.
What happens to the patient down the road, how it affects them. I'm really enjoying trying the new things, and I can really see the difference that it does make. I would say I am a firm believer in it.
I do think the comfort holds will help keep the patient comfortable and the parents comfortable and help bring down anxiety.
You yourself, as the MA or the nurse or physician, whomever is going in there, you have to be able to communicate well and tell that parent that is there with them or the caregiver that they need to hold on to the patient extremely tight and extremely well, and that they're not going to hurt them and that they'll be okay. And it's going to work. You're going to be really surprised how well it works.